Hello everyone, Ann and Mark Lemons here. We are back to talk a little bit more about the COVID-19 vaccine. We are going to answer some questions that have come in for both myself and my husband. We thought we'd just get on here and sort of rapid fire go through these, but please know that this is not to take the place of the advice from your own medical doctor. These are the types of questions and conversations you should be having with them. Okay, so you left us with a little bit of a cliffhanger last time because you had your first vaccine, you had a little reaction, and so we didn't really hear, everyone didn't hear what happened after that. So if you want to just quickly go through what happened after the first vaccine and then what you did and then how it went for your second vaccine.
Well, the vaccine administration went flawlessly. My shoulder wasn't sore. I did receive the Pfizer vaccine, and the following morning, through protocol, we had to fill out a questionnaire. Do I have any symptomatic side effects? And as I was filling out the survey, I'm like, oh, my throat feels a little bit funny. So anyway, I went in the mirror and I looked in the mirror, and lo and behold, my uvula was a little bit swollen at the tip. And I'm like, wow, do I answer the question yes or no? And so I answered it yes. So I had a little bit of swelling of my uvula the day after.
Okay, so then what happened before your second vaccine?
So that gave me quite a bit of pause.
Sure.
So I did a quick refresher course on allergic reactions, and this was definitely not an anaphylactic type 1 antibody response.
Okay.
This is more of a delayed reaction. But it gave me pause because it did involve the soft tissues of the airway. So I spoke to some friends and colleagues who were more expert at allergy than I was, and they recommended, why not get an antibody test to see if after one dose of the vaccine I mounted an antibody response.
Makes sense.
The reason for that is in some of the studies, some people were actually tested for antibody response. I would imagine because they had similar reactions. And they found that anywhere between 44 and 70 some odd % of people actually did mount an antibody response, so I thought I would do that. So indeed I did get antibody testing, and the results of which mean I had none. I had no antibodies. So now that was only 3 or 4 weeks after the vaccine, and everybody has a different rate in how quickly their immune system will develop an antibody response. That's something that's measurable. So I had to decide to get the second vaccine.
Okay, and the response after that one was pretty good, right? Not too bad?
No, I took Benadryl beforehand upon the advice of some specialists, and I stayed around for 30 minutes after the vaccine was administered. I had no allergic symptoms. The following morning, I think I even had less uvular swelling. The interesting thing is, so I had more body aches with the second one and fatigue, and whether or not I had memory issues, I leave that up to you.
A little bit, yeah. You were MIA for a little while.
Yeah, so I took a few extra naps that weekend. But for that, I took some ibuprofen because my shoulders were a little bit sore.
Okay, so that leads me into my next question, because there's questions about, should we be suppressing the inflammatory response after the vaccine? Should we be taking an Advil, a Motrin, or Tylenol? What are your thoughts about that in terms of, does it affect the effectiveness of the vaccine?
So that's a great question, and I think taking ibuprofen or Tylenol a day or two because if you have body aches after the vaccine, let's think about this. I mean, this vaccine response, it's a 2 or 3 week response. So taking 1 or 2 doses or 1 to 2 days worth of Tylenol or ibuprofen, I don't think it blunts the entire immune response.
Okay.
So it was a matter of comfort, but no, I had no concerns about it blunting the immune response.
Okay, so what happens if you don't have any response at all? You have no reaction to the vaccine. Does that mean that you're not mounting an antibody response?
I actually don't think so, and I say that because if you test people 30 years of age and older, and ask them for mono, and you ask them if they recall having mono when they were a teenager or a young adult, and if if you test 100 people, all of which, no, I don't remember having mono at all, and you test for serum antibodies, 90% will have antibodies. So I think you can have a very asymptomatic side effect
Okay.
and still mount an antibody response.
Right. And we also know that there's different parts of the immune system that are increasing as well, not just antibodies. We have other layers of immune defense that are rising that we just may not be able to measure.
Absolutely.
Right?
You have your
B
T
cell.
cell-mediated response in addition to the antibody response.
Yes. Okay. So now the tricky part, when we're looking at what are some of the risks, there have been some death, reports. What do you make of those reports and those statistics?
You mean death reports from the vaccine?
Yes, or they're saying there's deaths shortly after the vaccine. So what do we think about that?
So what we do know, that people who haven't received the vaccine and come down with COVID, that the mortality increases with age. As a matter of fact, it's over 10% for people 65 and older, and people with autoimmune illnesses or comorbidities like hypertension and being overweight and respiratory illnesses. We know that. There have been a few reports of people dying within a short time frame after receiving the vaccine. I believe the one most common that people talk about was that one physician actually developed ITP after the vaccine.
Right.
And we don't know if that's cause or coincidence. So I think the likelihood of a severe reaction from this vaccine is so low compared to the wonderful benefits. I would definitely err on the side of getting the vaccine.
Okay. All right. And then in terms of having a reaction to the vaccine, are people having a reaction to the PEG in it? What do you think? What do you think is the cause of the reaction of the vaccine?
So that's interesting. What I didn't expect to see, there were a few people that feel kind of short of breath after the vaccine, but we have not found an increase of pulmonary emboli or blood clots in that subset of patients who present very early after the vaccine. We have seen quite a few people complaining of body aches, fatigue, myalgias, low-grade fevers, but that seems to go away within a few days. Particularly after the second dose, they've experienced more severe side effects, or I would say symptoms, but that usually only lasts for 2 or 3 days.
Okay, so you don't think the PEG is a major contributor?
Well, I didn't used to think so. It's the number one laxative that people have heard about, Miralax, which is over the counter on the market, is PEG, and that's PEG at a higher molecular weight and very small amounts of that are absorbed. PGE is way more common in the industry than I even knew. It's present in cosmetics, fragrances, and believe it or not, it's present in some of the medications that are very commonly prescribed and people take on a daily basis throughout the country.
Do you care to elaborate on which of those common medications?
Sure.
Yeah.
So Motrin is one, which I took after my vaccine. A second commonly prescribed medication, Flexeril, as a muscle relaxer. One of the more commonly prescribed sleep meds, Ambien. And some mood stabilizing medications such as Effexor and Zoloft have a small amount of the PEG ingredient.
So interesting. So let's talk about the newer vaccine, the Johnson & Johnson. Do you want to tell us a little bit about that particular vaccine?
Well, Johnson & Johnson has been shown to be very effective at reducing the risk of hospitalization in the ICU and reduce the risks of death. We know that for sure. It works under a different technology. It's a DNA virus, adenovirus number 26. So that virus with inoculation, that actually does get into the cell nucleus, but it's attenuated such that the virus can't replicate, but what it does is produce the M-spike protein that the body recognizes to mount both a cell and humoral and antibody-related response.
Okay, all right. So let's switch gears a little bit and talk about our pregnant mamas. What do you recommend, or what is being recommended right now for pregnancy?
So really great question, and I think back, we had that similar debate and discussion around the influenza vaccine, and we found that when women are pregnant, their CD4 count really drops, so that actually puts them at risk for infection. And so with influenza, we found that those women who were pregnant, a small subset did become more ill and required ICU treatment. And the risk of the vaccine from influenza was much less than the consequences of coming down with influenza in a severe case. So we felt like the benefit weighed on the side of getting the vaccine. And that same kind of theory seems to be applying to COVID-19 as well. If the mother stays well, we do know that the COVID virus does get transmitted from mother to baby through the placenta. And so the risks are low from the vaccine. So I think in the American College of Gynecology and Obstetrics have come out and with shared decision-making, informed decisions, most people are erring on the side of recommending the vaccine versus not getting the vaccine.
Okay. And then what about going into the emergency room? Because this is your area. What are you seeing? How safe is that still to go into the emergency room?
Boy, that's an interesting question because we really live that. And our emergency department volume decreased by over 50% during the height of COVID because people thought, well, I don't want to go there because that's where all the COVID is.
Right.
And I kind of felt the same way. So I was able to reference an article in South Korea where 35 people cared for a really ill patient. And after the fact, they found out that patient had COVID-19. 7 of those people wore complete gown and garb because they were concerned about COVID-19, and the other 28 people only wore surgical masks. And the good news is none of those caregivers came down with COVID-19. So that message we took to our own staff, that everybody at work had to wear a surgical mask every minute of the day that they were on the floor, and then when they had to eat together, keep 6 feet of social distancing. So we felt that the level 1 surgical masks were quite protective, and we found that to be true because in 1 year only 5 of our staff members came down with COVID-19, and when we did contact tracing, we found out that their exposures were more out in the community than they were while at work.
That's amazing. That's really amazing. So how long do you think you'll be required to wear a mask at work?
You know, that's I keep saying it's an interesting question, but it is. And when I used to get the influenza vaccine, I didn't feel that strongly about wearing a mask at work.
Right.
But going forward, I think I am going to wear a mask during the influenza season, during the RSV season. And now we have some of the COVID variants that are being discovered in Europe, South Africa, and I think another one in New York recently. So at least for another year, and if not longer, I'm going to wear a surgical mask while I'm on the clinical floor for sure.
You know, I'm curious if what your flu rates were like this year in the ER.
Remarkably low. I have not, in this entire 6 months, I have not seen a positive influenza case.
That's
and
crazy.
I think that's the same experience in Australia.
Right.
And not to mention influenza, RSV, which is an illness that affects babies and causes severe respiratory distress. We have seen hardly any, and I think that's because of the people wearing masks in the community and people wearing masks at work.
So do you think that we should be going back to school in person at this point in time? What are your thoughts on that?
You know, Anna, I wrestled with that question quite a bit, and I will let you all know that the mental health conditions seems to be significantly on the rise, and I think we are social beings by nature, and people are feeling lonely, and they miss their relatives.
We need connection.
And I think studies show that actually connection and social gathering, it supports the immune system as well.
Absolutely.
So I think as we start coming out of this, more people have had the illness, more people are getting vaccinated, and I believe we're now in a phase where teachers are getting vaccinated, which I highly support. I'm a fan of people going back to school. Now, if I'm a parent and my child hasn't been vaccinated, I'll probably ask my children to wear a mask while they're in class, and when they eat lunch together to socially separate 6 feet apart.
Mm-hmm.
But I think I'm a big advocate of their getting back to school. I think they're missing a lot. I mean, you try your best with Zoom and online education, but I think at that age, they need to get
really
back to
tough.
school.
So what about the student athletes? Do you think that they should be wearing masks when they play? What are your thoughts about that?
Well, to answer that question, I'm going to put my former athletic hat on, and I played some high school basketball.
Mm-hmm.
We don't have to talk about how good I was or wasn't.
Mm-hmm.
But I would have found it really hard to run up and down that court while wearing a surgical mask. So, and we just found out this weekend that one of the teams in the NCAA tournament had to withdraw from the tournament because some of their teammates developed COVID-19. But I think if the athletes are tested and they're testing negative, and if you ask me, I would be okay with my son or daughter on the ball field if they've been tested and the other athletes have been tested. I'd be okay with them playing sports without a mask.
Okay. All right. So then the question remains, do you feel everyone should get vaccinated? Or is it too soon to answer that question?
I think, so that I'll go back when I was offered the vaccine. And I thought about friends and relatives, some of whom are older than 65, some of whom have autoimmune illnesses. And I thought, wow, if the risk of the vaccine was so low, and if I were vaccinated and I could protect my friends and relatives from me transmitting the virus to them, then yes. And I think now as we emerge and we start to reopen the country, I'm still a fan of the vaccine.
Okay.
And I think not only are we going to protect ourselves, but we're going to protect our friends and our neighbors, some of whom have an autoimmune illness that we may not know. So why not protect them?
Right. And autoimmune illnesses are on the rise, so we don't see that going away anytime soon. So I guess the last question would be, if you've already had COVID, do you need a vaccine? What are your thoughts on that?
Oh, fantastic question. And the good news is now we have some information out there, so it's even easier for me to make a recommendation. So we have found that through studies and people who've actually had COVID, that people 65 and under mount a really good antibody response, and that antibody and that immune response has stayed strong for 9 months. But what we did find that people 65 and older, they did not have that same long-lasting response.
Okay.
So I strongly recommend that the people 65 and older, sure, get a dose of the booster vaccine. But if you're a teenager or young adult, you had COVID illness,
Right.
and you haven't had the COVID fog or the long-lasting side effects, the antibody response is strong for up to 9 months.
That's amazing. Okay. All right. Well, thank you. I think that's it for the questions today. We really appreciate you spending the time with us. So please feel free to comment or share the video if you found it helpful. Until next time, everyone. Thank you.
Thanks for having me.